Welcome back, everyone. If you're ever in need for a doctor, it would be best to get the very best if you possibly could. Well, how would you find the best doctor? Well, it's nice that Seattle Magazine puts them all in one spot. They ask a whole bunch of doctors from all around the area who are the best in all the various fields. They put them all in one magazine. EV Magazine and Seattle Magazine team up to bring you the best docs. Kim Griffiths has been hitting hospitals and clinics to talk with some of them. Kim?
That's right, John. Doctors themselves were asked if they or a loved one needed a doctor in a certain specialty, who would they choose? Who would they trust for the very best care? Tonight, who his peers consider among the best in a life-changing field.
Excited?
Yeah.
Good.
Forgive Dr. Joseph Chebli of Northwest Hospital if he calls his patients losers. It's what they want to be, and the reason they've come to him.
All right, so remember we talked about breathing, walking, coughing. That's all you have to worry about.
Dr. Chebli is a bariatric surgeon. He does what's commonly referred to as weight loss surgery.
And basically the best way to think about it is we're just separating off the stomach into two pieces.
With a less than 2-hour operation, he can help his patients dramatically lose weight and, more importantly, gain back their health.
My passion is raising awareness and also the ability with a single intervention to change the life of someone forever. I mean, the idea of curing diseases that people have suffered with for years is just amazing.
Dr. Chebli thinks, aside from prevention, bariatric surgery is becoming a leading weapon against our nation's obesity epidemic.
Wow, Stephen, you're already on your second line. Nice work.
Months after surgery, most of his patients are hardly recognizable.
Nice work, Sienna.
Meet Katie Whitmore, first-grade teacher at the Bear Creek School, and see her a year and a half ago, before her gastric bypass surgery.
Well, my life has changed dramatically because it has opened up every opportunity and possibility to me because where I once had limitations, I no longer do.
Katie has shed 165 pounds. Also gone is her sleep apnea and daily back pain. Dr. Chebli knows the before and after images of his patients are powerful, but his focus is more on their picture of health.
Often these patients have multiple what called medical problems, comorbidities. The ones we see most frequently are type 2 diabetes, hypertension or high blood pressure, lipid problems like high triglycerides and cholesterol, and obstructive sleep apnea. Those are probably the 4 big ones. And we can cure all 4 diseases with surgery.
Bariatric surgery isn't for everyone. Potential patients must meet stringent criteria. But every day, Dr. Chebli is helping people lose a myriad of health problems, along with a lot of weight.
Bye-bye. Bye-bye.
Here are the other bariatric surgeons who made Seattle Magazine's Top Doctors 2007 list. Before anyone can become a top doctor, or any kind of doctor at all, it takes years and years of training. In the past, all of that training happened on people like us, real patients. But now, thanks to facilities like this, not anymore. The Institute for Surgical and Interventional Simulation is referred to as ISIS, named after the goddess of healing and magic.
Just identify the mouth and then go down the teeth. There we go.
This is where residents practice their technique before they try it out on us.
Now flex it up and you should see the trachea. There's the epiglottis coming into view right at the top of the screen. There's the epiglottis. There, now you can
Remember
see
the old operation game? It's a similar concept here, but on a more serious and high-tech scale. Doctors in training spend hours perfecting their surgical skills on video game-like computers and on very lifelike simulators. On this day's scenario, in the mock operating room, this patient is having surgery on his foot. A straightforward operation until he will have a life-threatening problem.
And in this instance, the residents will be unable to intubate the patient. An extremely frightening experience for anesthesiologists, and one that we have to train for regularly. How to manage a difficult airway one that we're unable to instrument.
Yeah, you know, I'm having a difficult time here getting this airway.
And so we'll be putting these new residents through that exercise, an exercise that we wouldn't want to happen on a real patient, nor would we allow to happen on a real patient. But on a simulator, we can do that.
Excuse me, doctor?
Yeah.
Am I supposed to be feeling anything right now?
The patient tells doctors although his lower body is supposed to be numb, he's feeling pain during surgery.
Oh, I'm really starting to feel that in my leg.
Lab technician Todd Krinke is the voice of the patient. From a room next door, he's also watching and listening to what the team is doing.
So I'm listening for what drugs they give him, and when they give him all the hypnotics that put him to sleep, I'm going to go ahead and start lowering the stats for a while.
You're going to be very comfortable here.
All right, okay, now you want to count back from 100?
But then as his system starts to crash and he's not getting oxygenated in this scenario, I'm going to go ahead and start elevating all the stats up. Then he just goes into almost full cardiac arrest and causes all sorts of problems that we hope they respond to.
Based on their actions, he'll make the patient's body react as it would in a real situation. From pulse to pupil dilation, even swelling, the simulator makes this as close to real as it can get. The point is to teach teams to communicate, stay calm, and learn how to make good decisions when bad things happen.
This environment is perfect for practicing those rare but scary skill sets.
And this time, the team makes all the right moves. The patient is saved. And someday, because of training like this, a real patient might be too.
That's it.